So having said that, okay, the recording is in progress. So let me just press continue. All right. So just let's get started by going over some of the definitions, because some people are not too clear on the definitions between osteoporosis, osteoarthritis, and rheumatoid arthritis, what the differences are. So let me just go over those definitions first. So osteoporosis comes from the Greek word meaning porous bones. And this occurs when the bones become less dense due to the reduction of calcium in the bones and predisposing them to fractures easily. And it affects mainly the wrists, the spine, and the hips. And it's often called the silent disease, as you do not experience any pain and only become aware of the disease if you have a fracture, or if you start to experience the rounding of the upper back as a result of asymptomatic vertebral fractures. So osteoarthritis occurs when the protective cartilage that cushions the ends of the bones wears down over time. And it usually affects the joints in the hands, the knees, the hips, and the spine. And it's usually accompanied by pain in the joints, as well as stiffness, bone spurs, and swelling. And rheumatoid arthritis is an autoimmune disease which affects the lining of our joints, causing painful swelling that eventually results in bone erosion and joint deformity. And it can affect all the joints of the body, causing tender, swollen joints and joint stiffness, which tends to worsen in the morning and with inactivity. So people with rheumatoid arthritis may also experience fatigue, fever, and loss of appetite. So getting back to osteoporosis. So osteoporosis affects men and women after the age of 50, but women are affected 4 times more frequently than men, and men tend to be affected after the age of 70. This is why it is really, really important to get a bone density test once you turn 50 in order to diagnose osteoporosis early and to treat it effectively. The most common treatment for osteoporosis includes medication when appropriate, the use of calcium and vitamin D supplements, avoiding excess alcohol and tobacco, and at least 90 minutes of weight-bearing and muscle strengthening exercises per week. So the most common causes of osteoporosis: certain medications such as steroids or anti-rejection medications can cause osteoporosis. Medical conditions such as rheumatoid arthritis, eating disorders, and some GI conditions such as Crohn's disease can cause osteoporosis. Family history. Although osteoporosis is not a hereditary disease, it is known as a familial disease, which means that it tends to run in families. Smoking. And people of small, thin stature are more prone to osteoporosis. A sedentary lifestyle and insufficient calcium, vitamin D, protein, or excessive consumption of alcohol or sodium. So people who are vegetarians are at a higher risk of osteoporosis, because unless they are taking in a lot of supplementary protein, they're at higher risk. So what's the difference between osteoporosis and osteopenia? So osteopenia is also occurs when bone mass is low, but it is not low enough to be classified as osteoporosis. So if you've been diagnosed with osteopenia, this is really the precursor to osteoporosis. So if you've been diagnosed with osteopenia, you want to start treatment right away. So osteoporosis and exercise. So this is what this is all about. So not all exercises are equal for those who have been diagnosed with osteoporosis. So what are the things that we want to avoid? So we want to avoid jumping or dynamic weight-bearing activities. For example, jumping rope, high-intensity step aerobics, intense cardiovascular activities like running, or even walking rapidly on an unstable or uneven surface. Some sporting activities can be problematic as they involve quick changes in direction. For example, baseball, basketball, football, or even tennis, which could result in a fall or what is known as bone shearing that could result in a fracture of either the hip, femur, or lower back. So bone shearing occurs when there is a repetitive action on the bone over time. So if you're doing something that you're doing repetitively over and over again, that's called bone shearing. So particularly in the vertebra with bone shearing, over time, it thins the bone and puts you in a much higher risk for osteoporosis. So you want to be aware of bone shearing. Golf can also be problematic for the spine due to the rounding of the back when you bend over repetitively to pick up the ball, or when you do that rapid, quick twisting of the spine when you're hitting the ball. These small movements can cause small fractures over time, weakening the spine further, or possibly one large fracture immobilizing you. So be very aware of that. So what are the recommended exercises? Well, walking, slow jogging, climbing stairs, pickleball, and or low impact dancing. These largely impact the legs. However, if you wish to impact the arms as well, yoga is highly recommended because there is often weight bearing on all 4 limbs. While yoga is beneficial, it must be practiced with a certain amount of caution. So the greater the thoracic kyphosis, so thoracic kyphosis is the rounding of the back, that's called kyphosis, the greater the risk to the vertebra. So forward folding or spinal twists with the spine in a C shape are dangerous for the thoracic vertebrae. So if you're in that rounded back position and you're doing some rotation, that puts you at high risk for fractures in the thoracic vertebra. So what should we do? So the first thing is to practice neutral spine postures. So for example, mountain pose, where you're standing up nice and straight in your mountain pose position. You can practice what we call reclining hand to toe position. So you're lying, lying on your mat, holding onto your big toe or supporting your foot with a strap and extending the legs straight out to the front. Or even, where are we? So, so any of the low lunge positions, any of the warrior positions, any table and all the plank positions. So those are all positions that are recommended that you can be encouraged to practice. So these are called neutral spine postures. So you want to practice lengthening the spine. So in any of your postures, particularly in the seated postures, lengthening of the spine, you're sitting up nice and tall and imagining that there's a string attached to the top of your head and that string is pulling you straight up. So that what happens is that you're getting into a neutral spine or a lengthening of the spine. So you want to also be practicing weight bearing on your hands. So this promotes the building of bone density in the arms as well as the legs. So any position, tabletop position, so tabletop, forward tabletop or reverse tabletop, all the plank positions, cobra, which is practiced on your mat, reverse tabletop, and downward dog, downward facing dog. So one of the positions you want to avoid is a position that's a balancing position, and it's called crow. And crow is where you're balancing your knees on your elbows with your hands resting on the floor. And that involves rounding of the back in order to maintain that balance. So this is quite problematic. So if you're doing any mat exercises when you're going into crow, please avoid doing the crow. There's no modification for that. So simply avoid doing it. So you want to also practice gentle back bends. For example, the bridge position on your mat, sphinx on your mat, baby cobra, modified camel. So modified camel simply means that you're going into that extension, back extension, and resting your hands on your lower back rather than reaching for your ankles or your feet. You can also get that gentle back bend by rolling up a towel or using a foam roller and putting it horizontally underneath your thoracic spine. So underneath the upper back as you're lying on your mat. So that creates a gentle back bend. You want to practice modified spinal twists and movements. So avoiding poses that round the back. So you want to modify side bends or twists. So side bends, modified side bends or twists are okay as long as the torso does not approach end range of motion. So for example, if we're doing a modified twist on our chair, what we tend to do is to bring one hand behind our back and then other hand across the knee. In normal rotation, we would rotate right around and look over our shoulder. So you're getting quite an extensive twist. In order to modify that, only come halfway. And then the rest of the twist is simply rotating the shoulder back and directing your gaze out at a 45-degree angle. So you're not looking over your shoulder, you're just rotating half the spine and keeping that neutral spine as you rotate around. And forward fold, any of the forward folds, you really want to maintain what we call hinging from the hips. So anytime when we're doing anything, when we're going forward, make sure that you hinge from your hips and that you're keeping a flat back. All right. The other thing that you really want to maintain is moving slowly. So when you're moving from pose to pose, you want to avoid frequent or repetitive changes of posture. So this occurs often when we're doing a type of yoga called Ashtanga yoga. Ashtanga yoga is often called power yoga, where we're moving from pose to pose with each breath. So that means that you're moving quickly from one pose to the next pose. So if you have osteoporosis, please be aware to slow down. So if you're in a practice where you're doing Ashtanga yoga, slow your personal practice down so that you're moving much slower. So you're not putting your vertebra, your spine at risk. So you want to be doing positions also that challenge your balance, but without sacrificing stability. So it's important to have something close by that can stabilize you, for example, a chair, or if you're close to the wall, using the wall to keep your balance so that you do not fall over. But balance is really important to work on because a fall can often result in a fracture. So that's why in our practice, we practice balance in each one of our classes because it reduces the risk of a fall. You also want to practice using weights of resistance. And the most appropriate type of resistance is what we call variable resistance, or using that stretchy band that we use so that you can adjust the tension according to your own needs. If you're going to be using hand weights, you want to be using either light or just moderate weight hand weights, as opposed to really heavy hand weights. So if you're using really heavy hand weights, it puts a lot of stress, not only on your wrists, but it puts a lot of stress on your thoracic and lower lumbar vertebra. So be aware of that. So what not to do? So you want to avoid extreme range of motion poses or movements. So that includes crunches or sit-ups. So if you're doing yoga on the mat, one of the positions that we do is a crunch in order to target our abdominal muscles so that we come up halfway and then go back down on the mat. So this is one of the positions you want to avoid getting into. So coming up halfway, because you end up rounding your back as you come up. Same being said, if you come all the way up from a lying position to a sitting position, so that in order to do that, you have to come all the way up and round your back in order to do that. Another one that you want to avoid is those deep forward fold positions where your hands are on the floor, because by doing that, again, you're rounding your back. So you want to modify that position by bringing your hands just onto the front of your legs. So instead, work your core by lying on your back and extending your legs straight up over your hips. Keep your head on the mat and then slowly lower your legs down to the floor and then very slowly bring them back up. So there's no undue pressure on your vertebral column when you do that. So you also want to avoid poses that require spinal flexion. So that's exactly what we're talking about, rounded back positions. So any of the forward fold positions, if you're lying on the mat, the position called happy baby, where you're bringing your knees right into your chest and holding onto your ankles or your toes, or just rolling from side to side. If you're in the standing position, where we're going from a forward fold, rolling right over, and then rolling up into a standing position. So again, that involves the rolling of the back. So instead of doing that, again, just emphasize it. If you're doing the standing, returning up to a standing position, your hands can be on the front of your legs, or your hands can be on a set of blocks, or your hands can be on the seat of a chair in order to maintain a flat back as you come back up. So again, that's involving the hinging from the hips, keeping the back flat, directing your gaze just ahead of you so that you're not dropping your head, and in doing so, rounding your back. So in order to stretch your hamstrings, an easy way to stretch your hamstrings is lying down on your mat and holding onto your big toe, extending the leg out in front of you, or using a strap and extending the leg out. If you're sitting on a chair, extend that leg straight out right from your hip, flexing your feet. And then you can lower that heel down onto the floor. And again, hinging from the hips, keeping that flat back. Only come as far forward as you can without rounding your back. So as soon as you start to feel yourself round your back off a bit in order to maintain that flat back. Okay, another one that you want to avoid are the big back bends. So if you're on your mat, upward facing dog, wheel. A wheel is a position where you're lying on your mat, your feet are on the mat, knees are bent, and your hands are behind you, and you're lifting your body up into a full back extension. So you're lifting the body up, and so your back is rounded like this. Or actually, your forward is rounded, your back is really extended. Okay, you want to also avoid a regular camel position, and that's the one where you're lying on your stomach and you're reaching for your ankles or your feet. So that puts your thoracic spine at great risk. So you want to avoid doing those. So you also want to avoid extreme side bends and twists. So avoid deep chair poses with the twist. So you're going into a chair pose where you're out like this, and then going into a twist. It's the twist that's problematic. The deep chair pose is quite fine as long as you're hinging from the hips. The other one that you want to avoid is where you're doing a chair pose or a standing pose where you're rotating around and bringing your elbow to the outside of your opposite knee. So again, you're getting a spinal rotation there that is putting your lumbar spine at risk. The other one that you want to avoid is a deep reverse side warrior. So when we do a side warrior normally, we bring our arm right up over here, and then we go right into the arm going right over and then looking underneath that arm. So in order to modify that, just bring the arm straight up over your shoulder and direct your gaze straight ahead. So you're not rotating around looking under your arm, and that the extended arm is straight up towards the ceiling as opposed to going right over your ear towards the opposite side. Okay, another one you want to avoid are inversions. So inversions on the mat involve headstands, shoulder stands, and handstands. So the most common one that people use on the mat is the shoulder stand, where you're bringing your legs up over your shoulders and you're resting on your shoulders and your cervical spine in order to go into a shoulder stand. So that's quite problematic because it puts a huge amount of pressure on the thoracic and cervical spine. Cervical spine is at your neck. So instead of doing those, you can do downward dog, bridge, or legs up the wall. So you want to focus on controlled movements and less on the intensity of the postures. So yoga is not a competition between you and the person next to you. So please work at your own level and your own pace. So we want to modify movements that bend the spine forward, backwards, or twist the spine as far as you can. You want to avoid movements that are done in a seated position. So you're sitting on your mat or on your chair and you're doing the extreme twisted position. You want to avoid a movement that forces the hip into full rotation with body weight. So the most common one that we do on the mat is called pigeon, where you're bringing one leg to the front of your body, crossing the leg in front of your body. The other leg goes behind, and then you're going forward, and the full weight of your upper body is resting on your forward legs. So you're doing extreme rotation of that hip. So you want to avoid that. You can modify that by coming only halfway and either resting your head on a stacked block or making a fist with both hands, bringing the fists on top of each other and resting your head on those fists. So there are ways to modify those positions. You want to avoid repetitive actions. So anything where you're doing rolling like a ball, rolling side to side, rolling from front all the way up to standing position, you want to avoid those particular movements doing repeatedly. And again, another one that you want to avoid is rapidly changing your position. So the most common one is on your mat when you're into downward dog, and most commonly people jump into forward fold. However, if you have osteoporosis, you want to modify that, simply walk from your downward dog into a forward fold. And as you do so, bring your hands halfway up your legs so that you're going into, again, that hip flexion with the flat back. The other one that you want to avoid is weighted twists. So the most common one that we tend to do on the mat is called Russian twist, where we're using either a weighted ball, we're holding the weighted ball in front of us, or a heavy weight, and then we're rotating from side to side, looking over to the side. So again, not only is that involving quite an extensive twist, but you're adding weight as well. So you're putting extreme pressure on the lower lumbar area. Again, you want to avoid repetitively bending forward as far as you can. So the most common one is sun salutations, where you're going from standing, forward fold, into plank, into cobra, back into forward fold, rolling up into chair and into standing. So that's done fairly quickly in order to get your heart rate up. Traditionally, that's what sun salutations are for. However, if you have osteoporosis, you want to slow that sun salutation sequence, slow it right down. So work at your own level, work at your own pace. The other one that you want to modify is chair pose, child's pose. So child's pose, traditionally our knees are together, we're kneeling on our mat with our head resting on the mat, forward fold, and that traditionally rounds our back. So in order to modify that, start by opening your knees a little wider than your hips, and that your feet come in so that they're touching, so that now you have a V shape on your legs, and then resting your head either on a block or stacking your fists again and resting your head on your stacked fists. Again, maintaining that hinging from the hips and the flat back. You want to modify the twists. The one that traditionally we do at the end of our programs on the mat is a stretch, where we're stretching the chest and stretching the side of our body. And we're lying with our arms out to the side. Our knees are bent, and we're dropping our knees over to one side and then looking over to the opposite side. So in order to modify that, drop the knees halfway and either rest them on a block or on a stack of blankets, so that your legs are only going halfway, so you're not doing that extreme rotation in your hip, in your spine. And at the same time, instead of looking over your shoulder, direct your gaze straight up towards the ceiling. Another one that you want to modify, may want to do to stretch is a lying pigeon, which stretches the outer part of our hips and our buttocks. So lying pigeon, you're crossing one leg over the other and bringing the knee into your chest, which is quite okay, as long as you keep your head on the mat. So you do not lift your head off the mat. The moment you lift your head off the mat, you're starting to round your back again. So the use of props is beneficial to keep you safe and in good alignment. They are not used for you to go into a deeper version of the pose. So the chair is very useful, but remember to lengthen your spine. So you want to avoid rounding your back. So anytime you're on your chair, you want to sit up nice and tall, lengthening your spine. Standing is quite safe. It benefits you because it's weight bearing and it improves your balance. And lying down is also quite safe. The other position, or the other question that people often ask is hot yoga safe? For people with osteoporosis, you want to avoid hot yoga because it tends to allow the muscles to overstretch, leading to poor stabilization of your vertebra and your hips. So just to recap, the benefits of yoga are to improve muscle strength, to improve balance, to improve posture, to improve body awareness. And finally, all of these benefits help to prevent falls, the number one cause of fractures in people with osteoporosis. So there, my friends, is a recap of what we've just been doing, what we've just been talking about, osteoporosis. So if you have any questions, I'd love to answer your questions. I see that it is 10:30. So what I am proposing is that you hold on to your questions until after we've finished the chair yoga portion. And then I will answer your questions if that's okay with everyone. Is everyone okay with that?
Oh, that's good.
Okay, so I'm just going to set myself up for our chair yoga. And then if you have any questions about what we just talked about, hold on to those questions and we'll do them. I'll answer those questions at the end of the session. So let me just get myself set up here. Okay, I'm back. So let's just start our chair yoga and keep in mind all the things that I talked about. See if you can remember the modifications, and I will continue to remind you of the modifications. So let's just get started by sitting up nice and tall. Shoulders are relaxed. Taking a nice deep breath in, and then very slowly let that breath go. And again, nice deep breath in, and then let that breath go. So as we breathe slowly in and out, let's take this opportunity to leave all our cares outside the door, connecting our mind and our body with our breath. Keep in mind that this is your own personal journey, and therefore we have no expectations. We never judge, and we're not in competition with anyone else, but simply allow yourself to enjoy the journey. Being present in the moment, ignoring all that monkey chatter that goes on in our heads. And take a moment now just to gently or mentally scan your own body, noticing any areas that need your special attention today. Feel free to either modify that position or simply come out of the position and join us when you feel comfortable. So as we breathe slowly in and out, let's just drop our chins to our chest. Then rotating your chin over to your right shoulder. Come back to the center. And then over to the left shoulder, breathing in. Breathing out back to the center. Again to the right as you breathe in. Breathe out back to the center. To the left as you breathe in. Breathe out back to the center. Then lifting your heads up into neutral position. Breathe in and out. Then making your way to the front of your chair. Arms are down by your side. Then lifting your shoulders up to your ears, rotating the shoulders back and down. And again, lift up, back, and down. 2 more times, lifting up, back, and down. Last time, lifting up, back, and down. Then bringing your hands to your heart. As you breathe in, opening the arms out to the side and all the way up to the ceiling. As you breathe out, bring the hands back to the heart. And again, breathe in, reach all the way up. Breathe out, hands to the heart. 2 more times. Breathe in, reach all the way up. Breathe out, hands to your heart. Last time, breathing in, reach all the way up. Breathe out, hands to your heart. This time, extending the arms all the way up. Then holding on to your right wrist. And then just go over slightly, so you're not going too far. Just over slightly, looking straight ahead. And just keep that right arm nice and straight. Slowly come back up. Hold on to your left wrist. Come up and over to the right. Again, you're not going into extreme stretch. It's just a slight stretch. And then come all the way back up. Letting go of the hands, bring them back behind you, lacing your fingers together, drawing your shoulder blades together, lifting your arms away from your body. Breathe. On your next breath, let's bring our hands back to the front, lacing the fingers together, turning the palms forward, and then pressing the arms straight out from your shoulders, noticing that nice stretch in the back of your shoulders. Then just extend those arms straight up to the ceiling, and imagine that you're waking up from a long sleep. So a nice, long, deep stretch. Breathe in, and as you breathe out, open the arms into cactus arms. Palms are facing forward, then squeezing your shoulder blades together. Breathe in and out. On your next breath, let's bring our arms to the midline, touching the elbows and the palms. Open the arms as you breathe in. Breathe out, come forward. Breathe in, open up. Breathe out, come forward. One more time, breathe in, open up. Breathe out, come forward. This time, open up, open the arms out, palms down. Then sweep the arms to the center, turn the palms up, sweep them back. And again, palms down, sweep them to the center, palms up, sweep back. 2 more times, sweep them forward, sweep them back. Last time, sweeping them forward, sweep them back, and then drop the arms down. Then bringing the left knee into your chest, hug underneath the knee, rotate your ankles in a circle. Change direction. Then flexing your foot, extend the leg out in front of you. Now drop that heel down onto the floor, toe up to the ceiling. Hinge from the hips. Slide your hands down the front of your leg. Keep your back flat. Direct your gaze just ahead of your mat, keeping your back nice and flat. Breathe in and out. In and out. And slowly come up, bring that foot back on the mat, right knee into your chest, rotate your ankles in a circle. Change direction, flexing your foot, extend the leg out, then letting the heel drop down onto the floor, toe up to the ceiling. Again, deep breath in, reach all the way up. And forward fold, hinging from the hips, slide the hand down the front of your leg and hold it here. Breathing in and out. In and out. Slowly come back up. Let's bring our heels onto the edges of our mat. Toes are up to the ceiling. Again, we're hinging from the hips, taking a deep breath in. This is a deeper stretch. Breathe in, breathe out, come forward. Slide your hands down the front of your legs. Now, if you can keep a flat back, feel free to reach for your toes. If you are rounding your back, keep your hands on the front of your leg. Breathe in and out. 2 more breaths. Last breath. Let's bring our hands back up. Slowly come back up. Bring the feet onto the mat. 2 sun salutations, and then we're doing chair squats today. We're doing 8 of them. Take a deep breath in, reach all the way up. Breathe out, cactus arms. Breathe in, come forward. Breathe out, come down. Breathe in, halfway up. Breathe out, come back down. Left arm comes up. Breathe out, come back down. Right arm comes up. Breathe out, come back down. Both arms up, breathe in. Breathe out, hands to your heart. One more time, breathe in. cactus arms, come forward, come down, halfway up, come back down, left arm up, come back down, right arm up, come back down, both arms up, hands to your heart. Chair squat, we're coming 8 inches off the chair, come back down onto the chair. We're doing 8 of them. So you can have your hands on your heart or at your hips. So you're coming up into this position, come back down, touch the chair, come back up. You've got 7 more to go. 7, touch the chair, come back up. 6, touch the chair, come back up. 5, touch the chair, come back up. 4, come back up. 3, come back up. 2, come back up. Last one. Now come back up and stay in that position. Extend the arms out over your shoulders and hold this pose. And we're holding this for 5, 4, 3, 2, and 1. Slowly come down onto your chair. Sit upright. Let's go into a warrior series. So rotating around to the right side. Extending the left leg out, press the back part of your foot into the floor, right knee over your heel. Arms are out parallel to the floor, shoulders are down. Here we're going into reverse warrior. Turn the right hand up. Reach forward, then go over. Now, you can hold on to your chair or you can rest your hand on the side of your leg. If you have osteoporosis, this is where you stay. If not, go over, extend that arm over your ear, looking underneath the arm. So again, you want to modify as you need to. And then slowly come back up into warrior 2. Going right into triangle, either hold on to your chair or hand on the floor. Left arm straight up to the ceiling. If you wish, you can bring that right hand to the inside of the right foot. If you wish to join me in standing triangle, let's bring our left hand onto our hip, right hand onto the seat of your chair, come up into a standing position, legs are straight, directing your gaze down towards your big toe. Then extend the left arm straight up to the ceiling. If you have osteoporosis, keep your gaze down towards the toe. If not, you can look up towards that extended arm. So again, when you're looking up, you're rotating the spine further. If you're looking towards your toes, you're keeping that spine neutral. If you wish to go into unsupported triangle, just slide your hand down the front of your leg. Breathe in and out. In. And as you breathe out, bring that left hand onto your hip, right hand onto the seat of your chair, pivot around so you're pivoting towards the right side of your mat. Then go into a lunge position. Front knee is bent, back leg is straight. From here, drop that back leg down, come back up, press the heel into the floor. Again, up onto your toe, come down, come back up, heel press. 2 more times, up onto your toe, come down, come back up, heel press. Last time, up onto your toe, come down, come back up. This time, keep the heel off the floor, and let's go into crescent. Left arm can come up. If you wish to challenge your balance, let go of the chair, bring the other hand up. Hold it here. We're holding this for 5, 4, 3, 2, and 1. Hands down. Back heel now on the floor. Hinge from the hips, come down. Left hand onto the floor. Now the right hand can stay on your chair, or you can bring the right hand behind your back or lift that right arm up over your shoulder. Now, if you have osteoporosis, direct your gaze straight down towards the floor. If not, you can direct your gaze up towards that extended arm. Breathe in and out. 2 more breaths. Last breath. Bring that right hand back down onto your chair. Begin to straighten your front leg. Resting your chest on your thigh. Direct your gaze just ahead of your big toe. And then bring your left hand behind your back. This is called pyramid. If you wish to challenge your balance, you can bring the right hand behind your back and hold it here. You're hinging from the hips. Keep the back flat. 2 more breaths. Last breath. Release the hands. Hand on your chair. Bend your front knee. Come back down onto your chair. Rotate to the front of your mat. Then let's just rotate all the way around to the other side. Going into that same sequence on the other side. Warrior 2. Going into reverse warrior, turn the front hand up, reach forward. Bring that arm up over your shoulder. Other hand can rest on your chair or on the side of your leg. Again, use the modification if you need to, keeping the arm straight up, or you can go over, extending that hand towards the right side of your mat, sliding your right hand down the leg. Breathe in and out. In. And as you breathe out, slowly come back up into warrior 2. And let's go right into triangle, dropping the left hand down, holding onto the chair or onto the floor. You can bring that left hand to the inside of your left foot. If you wish to go into standing triangle, bring that right hand onto your hip, left hand onto the seat of your chair. Come up into standing triangle. Both legs are straight, looking straight down towards your foot. Extending the right arm straight up to the ceiling. Use your modification if you need to. You can direct your gaze straight down towards your foot, or you can rotate around to look up that extended arm. If you wish to let go of the chair, unsupported triangle, you can rest your hand anywhere along your leg or onto your foot or onto the floor. 2 more breaths. Last breath. Then bring that right hand onto your hip, left hand onto your chair. Bend the front knee, then pivot around so you're facing the left side of your mat, nice and tall. Back heel is off the floor. Then sink down, come back up, heel press into the floor. Up onto your toe, sink down, come back up, heel press down. 2 more times, up onto your toe, drop down, come back up, heel press. Last time, up onto your toe, drop down, come back up. This time, keep the heel off the floor, nice and tall into crescent. One hand comes up, challenging your balance if you wish. You can bring the other hand up, holding it here, breathing in and out. 2 more breaths. Last breath. Release the hands and come back down. Bring your right hand down onto the floor. Now, press your back heel into the floor, and it's your choice. You can bring that left hand behind your back, or you can extend the left arm up over your shoulder. You can keep your eyes directed toward the floor, or you can look up, looking up over that left shoulder. If you have osteoporosis, modify, keep your gaze straight down so that there isn't a spinal twist. Last breath. Let's bring that left hand back onto the chair and begin to straighten your front leg. Again, you're hinging from the hips, chest is resting on your thigh. Keeping that left hand on your chair, you can bring the right hand behind your back. If you wish to challenge your balance further, you can bring the left hand behind your back and hold it here. Breathe in and out. in and out. Last breath. Bring the hand onto the chair, bend your front knee, slowly come back up, come onto your chair, rotate to the front. Legs are nice and wide apart. So we want to keep those legs nice and wide apart. Hands on the inside of your thigh, your knees. Hinge from the hips first. So you're hinging from the hips. Now, just rotate your left shoulder in, pressing into the inside of your leg. Now, if you have osteoporosis, direct your gaze straight down to the floor. If not, you can look over your right shoulder. 2 more breaths. Last breath. Come to the center. Slowly come back up. Again, we're doing this on the other side. Hinge from the hips first. Direct your gaze ahead of you. Rotate the right shoulder in. Press into your inner leg. Osteoporosis, look down. If not, look over your shoulder. Come back to the center. So we're doing that again, but this time we're adding a pulse. Come forward, hinge from the hips, rotate in, and then add that pulse. So it's 4, 3, 2. Now hold it here, and then come back up. Other side, come forward, rotate in, add the pulse. So that's 4, 3, 2, and 1. Hold it here. Slowly come back up. Good work. Let's bring our hands to our hearts. Again, we're hinging from the hips. This time our elbows are on the inside of our knees, and then just press into your hands. Again, make sure your back is flat. You're hinging from the hips. So maintain this position, nice flat back. Then bring your hands behind your back, lacing your fingers together. Lift the arms up over your back as high as you can. So please maintain that hinge from the hips. Avoid rounding your back. If you find that this is too extreme, you can lower your arms, or you can simply let go of your hands, directing your fingers towards the back of your chair. So you choose whichever position works for you. Release the hands. Bring the hands onto your knees. Keep the back flat. Come up. Then bring the heels onto the edges of your mat. Toes are up to the ceiling. So we're hinging from the hips again. This time, you're going to feel a nice stretch in the back of your legs, and we are going to do a spinal twist, so modify as you need to. So take a deep breath in, reach all the way up. Breathe out, forward fold, hinge from the hips. Now, hands are on the floor, looking straight ahead. If you have osteoporosis, you can stay here, or you can rotate around, hold onto your big toe with your left hand, resting your right hand onto your leg, or bringing the right hand behind your back. Breathe. So you want to go deep into this position without rounding your back. Then bring the hands back to the center. Walk your hands over to the other side. Reach your toes with your right hand. Left hand can remain on your ankle or behind your back. Sink into this. Hold it here. Breathe in and out. In and out. Bring your hands to the center. Flat back. Slowly come back up. And then let's go into Warrior 2 on the right side again. Going into our open and bound ankle sequence. Come forward, dropping down onto your right elbow. Left arm straight up to the ceiling. Then let's bring our left arm straight over your ear. So you have a nice straight line from your fingertips all the way down the side of your body to your heel. And then turn your left hand to the front of your mat, sweep it back across your back to your opposite hip. Osteoporosis, stay in this position. If not, you can rotate around looking over your left shoulder. So again, make sure you modify as you need to. If you wish to go into a deeper position, drop that right hand onto the floor. If you wish to go into modified bound angle, slide that right hand underneath the seat of your chair. If you wish to go into unsupported bound angle, start by bringing that right elbow onto your knee. Then come up into a standing position, making sure that that front knee is traveling over your heel. And again, your choice, you can either look straight ahead or rotate the shoulder back. If you have osteoporosis, this is as far as you go. If you wish to join me in the bind, you can bring your right hand underneath your leg, grasping hold of your left hand. Dropping your right shoulder down parallel to your knee. And we're holding this for 5, 4, 3, 2, and 1. Release the hands. Rotate to the front. Drop down onto your chair. And rotate towards the left side. Going into that same sequence on the other side. Dropping down onto your left elbow. Right arm straight up to the ceiling. Then going into extended open angle, arm over your ear. Fingers are pointed to the side of your mat. Nice long stretch. Then turn your right hand towards the front of your mat, sweep it back across your back to your opposite hip. Again, modify as you need to. You can stay here, or you can rotate around looking over your right shoulder. If you wish to go deeper, you can drop that left hand down onto the floor. If you wish to go into modified bound angle, slide that left hand underneath the seat of your chair. If you wish to join me in unsupported bound angle, left arm onto your knee, come up into standing position. And again, anyone with osteoporosis, stay here. And if you wish, you can join me in the bind. Bring your left hand underneath your leg, grasping hold of your right, and hold it here. And we're holding this for 5, 4, 3, 2, and 1. Release the hands. Rotate to the front. Come back down onto your chair. Let's bring our feet together. So today we're going into the planks. Today is plank day. So let's just start by bringing our hands onto the seat of our chair, pressing into the fleshy part of our hands. Fingers are pointing down. If you're just beginning this practice, you may wish just to come off your chair and come back down. If you wish to go into tabletop position, walk your feet forward a bit, press into your hands, come off your chair, then shift your weight forward and then flatten your back, lifting your hips up, drawing your shoulder blades together. If you wish to go into reverse plank, keep that position, walk your feet out, lift your hips up. Hold it here. We're holding this for 5, 4, 3, 2, and 1. Walk the feet back in, and then come onto your chair. Rotate your wrists. Then crossing your left leg over your right. We're going into a twist, then into eagle, and then into seated pigeon. So the twist, extend the right arm out, bring it across your knee. Left hand goes behind. Anyone that has osteoporosis, only go halfway. Anyone else, if you feel free to join me as I go right around, looking over my left shoulder, drawing that left knee towards the midline, left shoulder back. Breathe in and out. In. And as you breathe out, come back to the center, going into eagle. So you have a couple of choices. You can keep your leg here, or you can tuck that left foot behind the right leg. Sitting up nice and tall, you can cross your arms, or bring the left elbow to the center, right arm dives underneath, palm to palm, come up onto your toes, then hinge from the hips, direct your gaze ahead of you, keep that flat back, and come forward. So only come far enough forward that you maintain that flat back and hold it here. Breathe and out, in and out. Last breath. Slowly come back up, unfold the arms, let the leg go loose. Again, you can stay in this position, or you can bring the leg halfway along, or you can bring that ankle across your opposite knee. Then resting your hand on the inside of your knee, holding your foot. Again, hinging from the hips, shoulders are relaxed. Breathe in. As you breathe out, come forward. Direct your gaze ahead of you. Again, each time you breathe out, try to come a little further forward. You may notice a deep stretch deep in your left buttock and hip. This is called a piriformis stretch. Very effective stretch. Slowly come back up, unfold the legs. Hands on the chair again, going into our tabletop or reverse plank. Come up, walk your feet forward, shift your weight forward into tabletop. If you wish, you can walk your legs out into reverse plank and hold it here. We're holding this for 5, 4, 3, 2, and 1. Walk the feet back in onto your chair. And then crossing the right leg over the left, going into our spinal twist. Left hand comes across your knee, right hand goes behind. Modify as you need to. You can go halfway around and just look out to 45 degrees, or you can rotate right around looking over your right shoulder. So pulling that right leg towards the midline, right shoulder away from the midline. Come back to the center, going right into eagle. Choose either to keep your foot here or tuck that foot underneath the other leg. Right arm here, left arm underneath, palm to palm, lift up to shoulder height, come up onto your toes, hinge forward. Again, make sure your back is flat and you're hinging from the hips, directing your gaze straight ahead of you. Only go as far as you can without rounding your back. 2 more breaths. Last breath. Slowly come back up. Unfold the arm, unfold the leg. Choose any position, either keep the leg here, the leg halfway along, or your heel on top of your knee, resting your hand on your thigh. Hinge from the hips, come forward. This is seated pigeon. Again, make sure that you're looking straight ahead and you're hinging from the hips. Keep coming forward until you find that spot where you can go no further. For anyone that does a lot of running or walking, or if you've been diagnosed with a condition called piriformis syndrome, which is low back pain, this is a very important stretch for you. Then slowly come back up. Unfold the legs. So we're going into our standing positions. So let's stand up. You're going to bring your chair to the front of your mat. If you're joining us for the first time, be aware that you will lose sight of my upper body. Don't worry about it. It's the lower body you want to see, and that's what you're going to see. So let's turn or you're going to face the back of your chair. And let's just start by pedaling our feet right and left. So we're just getting some flexibility in our feet. So today we're going to challenge our balance by opening the legs a little bit wider than your hips, turning your toes out 45 degrees, then coming up onto your toes. Keep that back flat, and then come down as low as it's comfortable, keeping the back flat. Then come back up heel press into the floor. And again, come all the way up, come down, come back up, heel press into the floor. Got 3 more to go. Come up onto your toes, come down, come back up, heel press, 2 more to go. Come up onto your toes, come down, come back up, heel press. This time we're adding balance. Come up onto your toes, come down. Then you can bring your hands onto the seat of your chair. You can take one hand off the seat. You can take both hands off. And you're holding it here. We're holding this for 5, 4, 3, 2, and 1. Hands on your chair. Slowly come up. Heel press. Step back from your chair about 3 feet back. Bend both knees. Arms over the back of your chair, looking straight down towards your mat. Then slowly begin to straighten your legs. Feel that nice stretch in your lower back. This is a modification of downward dog. Then keeping that position, extend the left leg out behind you, lift it hip height. Hold it here. Now, if you really want to challenge your balance even further, you can take one hand off the chair and just have one arm on the chair. Hold it here. Breathe in and out. In and out. 2 more breaths. Last breath. Bring the arm down. Bring the foot down. Let's do the same thing on the other side. Maintain that flat back, hinge from the hips. Extend the right leg out. Lift it hip height. Hold it here. Again, if you want to challenge your balance even further, take the right arm off the chair. Hold it here. And we're holding this for another 4 breaths. 3, 2, and 1. Arm on the chair, feet down. Lift your head. Come back up. Walk towards your chair. Then make your way to the side of your chair. So again, I mentioned that today is plank day. So we're going to go right into it. So we're stepping back 3 feet from the chair. Again, we're bending our knees. Bring your hands onto the chair, halfway along on your chair. Straighten your legs. Now, come up onto your toes and then shift your weight forward over your hands into plank position. Let's challenge ourselves a bit further. Take 1 foot off the floor. Challenge a bit further. Bend your elbows, come down 1 inch. Come down another inch. Come down a 1/3 inch. Press it back up. Again, come down 1 inch. Another inch. Another inch. Come back up 1 more time. Down 1 inch. Another inch. 1/3 inch. Come back up. Feet down, back into downward dog. Feel that nice stretch in your lower back. So we're doing the same thing, but we're going to take our other foot off the floor if you wish. Lift your head, come up onto your toes, shift your weight forward, choosing either to keep both feet on the floor or take 1 foot off. Then come down 1 inch. 2nd inch, 3rd inch, press up. And again, down 1 inch, 2nd inch, 3rd inch, come up. 2 more. 1, 2, 3, come up. Last one. 1, 2, 3, come up. Feet on the floor, back into downward dog. Nice long stretch. This time, you're coming up onto your toes. Come forward into plank. Then open the legs about the width of your hips. Then rotate your toes so they're facing the front of your mat. Right hand on the center of your chair. And then extend the left arm straight up to the ceiling. Hold it here. We're holding this for 5, 4, 3, 2, and 1. Hands down. Rotate to the front. Go back into downward dog. We're doing the same thing on the other side. So first, come up onto your toes. Shift your weight forward into plank. Bring your left hand to the center of your chair. Rotate your toes to the back of your mat. Then lift your right arm up to the ceiling. Hold it here. For 4, 3, 2, and 1. Hands down, rotate to the front. Back into downward dog. Walk your feet in. Take a nice deep breath. Then walk your feet towards your chair. Hinge from the hips, come all the way up. Good work. So today, we're doing just 2 balance poses. We're doing warrior 1 with humble warrior and tree pose. Warrior 1, step back with the outside leg. Press your heel into the floor. Bend your front knee. Now, make sure your feet are parallel. Sink into this. Palms are facing each other. Come up into warrior 1. Arms are straight up over your shoulders. 2 more breaths. Last breath. From here, we're going into humble warrior. Sweep the arms back behind you. Then drop your chest down towards the floor. Hinge from the hips. Extend the arms out behind you. Hold it here. Breathe in and out. In and out. 2 more breaths. Last breath. Slowly come back up. Hinge from the hips. Bring that outside leg to the right. And then into tree. You can rest your foot on your ankle, on your calf, or on your inner thigh. Make sure your knee is pointing out to the side. Left arm comes straight up. Right hand, you can hold onto your chair. 2 fingers on the chair, 1 finger, or you can let go of the chair altogether. Hold it here. And we're holding this for 5, 4, 3, 2, and 1. Bring the hands down. Turn the knee to the front. Extend that leg out in front of you. Bring the heel onto the floor. Bend your back knee. Hinge from the hips. Slide your hands down to your toe. Feel that nice stretch in the back of your leg and into your lower back. Make sure your back is flat and you're hinging from the hips. Last breath. Slowly come back up, feet together. Let's make our way to the other side. And we're doing that same sequence on the other side, starting with warrior 1. Right leg goes back, front knee bent, back leg straight, heels on the floor. Hinge, hips are facing forward. Bring one hand up. You can bring the other hand up into warrior 1. Hold it here for 5, 4, 3, 2, and 1. Into humble warrior, hands go behind you. Hinge from the hips. Come forward. Keep that front knee bent. Back leg straight. Backs are straight. Hinge from the hips. Holding it here for 5, 4, 3, 2, and 1. Slowly come up, keep the back flat. Bring the feet together into tree, knee pointing out on your calf or on your thigh. One hand comes up, other hand, you can hold to chair, 2 fingers, 1 finger, or no hands. Hold it here. We're holding this for 5, 4, 3, 2, and 1. Hands down, knee to the front. Extend that leg out in front of you. Heel on the floor, bend the back knee. Hinge from the hips. Slide your hands down. You can reach your toes. Feel that nice stretch in your lower back, into your hamstrings. We're holding this for another 4 counts. 3, 2, and 1. Feet together, flat back, come back up. Let's make our way back to the back of our mat. Bring the chair back and sit down. This is a good time for a drink of water, and then get hold of your stretchy band. All right. Today, we're starting with the upper body. So let's just start with the band across our thighs, opening the hands just about the width of your mat, sitting up nice and tall. Come all the way up. And then from here, pull down to the left. Slowly come back up. And again, down. Slowly come back up. So we're doing 8 more. 8. Come back up. 7. Come back up. 6. Come back up. 5. Come back up. 4. Come back up. Keep control. 3. Keep control. 2. Come back up. Last one. Hold it here. We're holding it for 5. 4. 3. 2. And 1. Come back up. Same thing on the other side. Come all the way down and slowly come back up. And again, pull all the way down. Make sure you're sitting tall. Come back up. 8 more. 8. Come back up. 7. Come back up. 6. Come back up. 5. Come back up. 4. Come back up. 3. Come back up. 2. And up. Last one, you're holding it here. We're holding this for 5. 4. 3. 2. And 1. Come back up. Bring the band down. Move your hands closer in. Working the mid back and the back of our shoulders. Come back up. Pulling behind our head, elbows are bent. And then pressing out, right out from the shoulders. Come back in, reach up. And again, pull, press, in, reach. You've got 8 more to go. 8, press, in, reach. 7, press, in, reach. 6, press, in, reach. 5, press. Keep the elbows parallel to the floor and reach. 4 more, press, in, reach. 3, press, in, reach. 2, press, in, reach. This time you're holding it here. We're holding it for 5, 4, 3, 2, and 1. Press out, hold it here for 5, 4, 3, 2, and 1. Add the pulses. 4, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and release. Bring the band underneath your arms. Gather up all the loose ends. And the tighter the band is, the harder the work. Knuckles are facing each other, elbows are wide, making a great big circle and then crossing at your wrists. So cross over at the wrists, come back in. And again, big circle around, then cross. Come back in. Elbows are up. So you've got 8 more to go. 8, come back in. 7, come back in. 6, come back in. 5, come back in. 4, and in. 3, and in. 2, and in. This time, hold it here for 5, 4, 3, 2, and 1. Then pulses. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Relax. Good work, everyone. Whew. Let's bring the band across our legs and working the lower leg, or lower body rather. We're starting by putting the band, you can start with the band high on your thigh if you wish, or just above your knees, or making it even harder by bringing it across the front of your legs. If you've had a hip replacement, please keep the band above your knees. Then wrap the band behind the legs and bring the band up over your thighs. And again, the tighter it is, the more intense the work. Make sure your knee and your foot move as a unit and you're pressing out to the side as far as you can. Press out, come back in. Press out, come back in. You've got 8 more to go. 8, and in. 7, and in. 6, and in. 5, and in. 4, and in. 3, and in. 2, and in. This time you're holding it out. Hold it here for 5, 4, 3, 2, and 1. Then we're adding the pulses. Really push for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Walk your feet back in. Unfold the band. Then extend the left leg out. Pardon me. Then bring the band across your foot, starting at the top. Gather up all the loose ends and then bring that knee in. Bring the knee to your chest. Sitting up nice and tall, flexing your foot. Press out with your heel. Press out for 10 and in. 9 and in. 8 and in. 7 and in. 6 and in. 5 and in. 4 and in. 3 and in. 2 and in. This time hold it out. Sit up tall. Add the pulses for 10, 9, 8, 7. Put the brakes on. 6. Come on, work it. 5, 4, 3. Come on. 2, 1. Hold it out. Take both ends of the band in your left hand. Right hand can hold onto your chair or out to the side. Lift the leg up. Let it float to the side. Keep your hips pointing straight ahead. Sit up nice and tall. External rotation here. Then bring the leg to the center, take the band in your other hand, arm out or hold on to your chair. Hip replacement, stay here. If not, cross over. Again, make sure you're sitting up. Don't let yourself slump back like this. Sit up nice and tall. Good work. Come back to the center, take the band in your left hand, bring the foot down. Then rotate so you're facing the right side of your chair. Now you have two choices. You can stay on your chair and lift the leg like this, or holding on to the back of your chair, come up into a standing position, bring the knee underneath your hip. Then if you wish, you can lift that leg up as high as you can. Keep the knee pointing straight down. Hold it here. If you wish, you can let go of the chair and hold it here. So it's your choice. Last breath. Bring the foot down. Take the band away from your foot and come back onto your chair. So we're doing that same sequence on the other side. Bring that leg out. Wrap the foot band around your foot. Bring the foot in, knee to your chest, press out and in, out and in. You've got 8 more to go. 8 and in, 7 and in, 6, 5, 4, come on, press those heels out. 3, really push. 2, 1, hold it out, sit up tall. Add the pulses. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Take both ends of the band in your right hand. Hold on to your chair, arm out, lift the leg, sit up tall. Then come to the center, hold on to the band, chair or arm out. Hip replacement, stay here. If not, cross over. Hold it here. Last breath. Come back to the center. Bring the foot down. Take the band in your right hand and rotate around. Choose either to stay seated, knee under your hip, or standing. Stand up. Bring the leg up. Lift the leg up, hold it here. Knee pointing straight down. For 4, 3, 2, and 1. Bring the foot down, take the band away, put it to the side. Sit back on your chair into a final Savasana. Sitting up nice and tall. Start to listen to your breath. Going into our final Savasana as we relax our neck and our shoulders. Then lifting your toes off the mat. Rotate your ankles in a circle. Change direction. Resting your feet on your mat. Then let's start to relax our legs. As we move up our legs, notice our thighs become warm and heavy. Then moving up into our lower back. Let's give our body permission to let go of all the tension we may be holding in our lower backs. Let that tension move from your back into the back of your chair. Breathe. And starting our 3-part breath. Breathing through your nose, starting your breath right from your belly, moving to your ribs, then into your chest, and then very slowly let that breath go from your chest, moving down to your ribs, and down to your belly. And again, breathing through your nose, starting at your belly, moving to your ribs, into your chest, and this time let's hold that breath. ready, slowly let that breath go, starting at your chest, moving to your ribs, and down to your belly. Let's continue to breathe slowly in and out as you start to relax your neck and your shoulders. And relaxing your jaw by opening your mouth slightly, relaxing your tongue and your throat. Let's take a moment to gather up all our negative thoughts. Anything that would have caused you any distress today, tie those thoughts to an imaginary balloon and let your balloon go. Watch it float up into the sky, taking all those negative thoughts with it, replacing those thoughts with those of love, of joy, of gratitude, and finally, of harmony. Feel the waves of relaxation moving from the top of your head to the tips of your toes. You're now at peace, mind, body, and spirit. Today's reading is very short. It's called Happiness. Happiness is a choice, not a result. Nothing will make you happy until you choose to be happy. Your happiness will not come to you if it can only come from you. Let us bring our hands together in prayer position, heart center. I thank you for allowing me to guide you through your journey today. The light and love within me salutes the light and love within you. Namaste, everyone. Namaste. And whenever you feel free to open your eyes and feel either free to go, or if you wish to stick around, if anyone wants to ask me any questions about what we did about the talk on osteoporosis, I'm only too glad to answer your questions. Or if you've got any thoughts about osteoporosis, we'd love to hear from you. Anyone got any thoughts or questions that you wanted to ask that you weren't able to ask before we started our class?
Hi, Claire.
Yeah.
I had a call with my osteo doc in the
Yeah.
middle of the class.
Yeah.
Told her I had 3 pages of notes on osteo and that I'm not sure I'm doing things right, but you've certainly been specific about modifying the positions. She says you've gone over and above what one could expect.
Oh.
And so I can keep on doing the program. I asked about a bit of tingling, a bit of tingling itch along my spine
Yeah.
after class. And I didn't know if it was because I'd gotten my second vaccination, because that seemed a little new the day before. That was on Monday. And she says that has nothing to do with osteo. So
Right.
I got that question answered.
Great. So, excellent. Yeah. So terrific.
All I need now is a one-on-one to make sure I'm doing the positions correctly. So I have to drive to Bolton someday.
Well, you're only too welcome to do so.
Thanks very much.
I just wanted to, for people that came on after we did the talk, just want to let you know we did record the talk. I hope it got recorded. So we're hopefully going to be able to post the talk. I thought it was going to take me 10 minutes. It turned out to take 25 minutes. So I'm sorry that we went a little over time, but hopefully it is recorded, and hopefully we'll be able to put it on the Parlour Project web page soon. And I'll let you know when if and when it goes on, and if you want, you can access that talk. Any other questions or any other thoughts about what we did?
Well, thank you very much, Claire. You've done a great job.
Oh, good. I hope everyone's got a better understanding of the differences between osteoporosis, osteoarthritis, and rheumatoid arthritis, because sometimes people get those 3 different ones mixed up, what happens at the joints. So hopefully it was clear enough that people understood the difference between them.
Claire,
Yes.
I did speak to my chiropractor about yoga and whatever, and he said that, I have it, but my spine is actually in good shape to do most of it. But I said I still won't do the complete turnarounds, but I can do everything without using a lot of props. So, I mean, that's just me. I mean, others wouldn't say that, but my doctor just didn't know much about it and just said I had to do weight bearing, do this, do that, do that. So I don't think it's got too much, but he did. He just said based on because he does X-rays, of course, and he said pay to do most. I can do any of it if I want to. So
right. You may have missed the first part, but the thing that I pointed out at the beginning of the talk was that one of the treatments for osteoporosis is in fact 90 minutes of weight bearing and strength training per week. So, anything where you're doing weight bearing or strength training is really important to keep those bones strong and healthy, even if you do have either osteopenia or osteoporosis. So just by modifying some of the positions, but still by doing your exercise, you're doing yourself a favor. And the reason that yoga is so important or so beneficial is because not only do we do weight bearing on our feet, but we do weight bearing on our arms. So we're getting that benefit in our upper body as well as the lower body.
and that's why we take all the Parlour classes.
That's right. Yeah,
So much weight bearing exercises during the week.
exactly.
You do an excellent job, Claire.
Thank you so much.
Yeah.
One more question, Claire.
Yeah.
When we put our hands on the side of our chair and do some lifting, it's where you're putting weight on your wrists.
Okay.
I forgot about that because your wrists kind of.
Okay, so you've got to be very careful. I'll emphasize over and over again, first of all, that you're pressing into the fleshy part of your hand. And then when you push into the chair, your fingers are pointing straight down. So you don't want to have your hand flat on the chair. The fleshy part of your hand is on the edge of your chair and your fingers are pointing straight down. So you've got what we call a neutral wrist, so that you're not what we call hyper extending your wrist. So by keeping a neutral wrist, you're actually distributing the weight along the full length of your arms and your shoulder.
Good.
I have a tendency to use my thumb.
Oh, yeah, you don't want to do that. That puts a huge.
I can't hold it with just my thing. I have to use the thumb.
Well, you can use your thumb to give you balance, but you don't want to put excess weight on the thumb.
Well, I just can't not put the thumb down.
No, I'm not suggesting not putting your thumb down, but you have to make sure that the weight is distributed for the most part in this hand. Taking the thumb off may put you off balance. Okay. So keeping the thumb down, it gives you that balance, that tripod effect to keep you from losing your balance. But definitely making sure that your wrists are pointing down, because the moment you're flexing your wrists like this, you're putting all your body weight on these small little bones right here. Mm-hmm. By keeping a neutral wrist, you're distributing the weight along the full extent of your arms.
Mm-hmm. Very good.
Any other questions?
Thank you.
You're welcome.
Good. Yeah.
I've got one more.
Yeah.
When I get up in the morning, when I'm awake and done a stretch or two, it feels really good to just from the lying position, move up.
Like rolling up.
Yeah.
Okay, so that is problematic because so what you do is you roll over onto your side.
Yeah.
Use the side that you're rolled over onto, bend your knees, bring that hand onto your mat, and then push yourself up sideways into sitting position.
Right.
Rather than rolling up. That's very problematic if you have osteoporosis, because you're putting a huge amount of pressure on your lumbar spine because you're lifting the full weight of your upper body. So
Darn.
you gotta be careful of that.
Yeah, I suspected that after this.
Yeah. One of the good stretches, though, if you go on to the Parlour Project and you go onto the YouTube the videos, we did a video of a stretch you can do in the morning, and it involves a series of 4 stretches going from downward dog, bending knees, straight knees, then into plank, into a neutral plank, and then into coming forward and arching your back and looking up. And that's a really effective stretch for your lower back and stretching your hamstrings. And that's usually what causes low back pain when you get up in the morning, is the fact that we have very, very tight hamstrings because we tend to either lie on our sides or because we're inactive for 8 hours or so. The hamstrings and the lower back are really tight, and that's what causes that back pain that we get. So if you can do those stretches, I normally do them after my shower so that my muscles are nice and warm. And then I do those stretches at least twice, maybe 3 times. And it's easy to do in your bathroom because the height of your sink is usually the right height for your hands to be. So that's a really, those series of stretches, if you go on the web page and look for the YouTubes, I think it's called Clare's Stretches or something like that. And just have a look at it.
Very good.
Very good.
Okay, everyone.
Thank
So
you.
I'm sure you all want to go out and enjoy the nice weather. So if you have any other questions, feel free to either email me or keep the questions and I'll answer them on Friday.
Great.
Have a great day, everyone. See you on Friday.
Bye.
Bye now.
Bye.
Bye, guys. It's Tina's son. She had to go out. So, bye, guys.
Bye.